established the Peregrine Eye and Laser Institute back in 2013. 5 years on, it has grown to treat the most complicated eye infirmities with their state-of-the-art equipment and doctors. Here to talk about these eye ailments and their treatments are the two founders of Peli, Dr. Harvey Uy and Dr. Pik Sha Uy. Welcome to the show. Welcome to the show, doctors.
It's a pleasure to be here.
Okay, so let us begin. No Filipino should go blind. That's a good motto there. So, what is Peregrine doing to help to help achieve this goal?
So we have established in Peregrine Eye all of the state-of-the-art facilities, and we have gotten a good team of very well-trained doctors to be able to deliver these eye care services.
Okay, so I'm reading here. You're actually pioneering some of the latest technology used in treating eye ailments right now. So can you share some of them with us?
Well, the most common eye ailment would be error of refraction.
Okay.
Both of us are wearing glasses.
Yes. Okay.
And a lot of patients, they cannot see without glasses. So one of the new technologies is to put a contact lens. We call it a phakic lens. We put that inside the eye. It's a 5-minute procedure, and afterwards the patient can see perfectly well without wearing glasses. And this is for the lifetime of the patient.
Okay, so I think I might sign up for that then. Okay, so Dr. Pik Sha, I understand you're specializing in pediatric ophthalmology.
That's correct. Yes.
So can you share with us what's the latest on that field right now?
Well, actually, for pediatric ophthalmology, what is most important is awareness. Okay, because a lot of people are not aware that actually children can have serious eye diseases, and if they're not detected early and not treated early, it could be a permanent thing. So that's what we're trying to basically educate parents and of course everybody that they should bring their child in for eye check, because there's a lot of eye diseases that we actually can treat.
Okay, Dr. Pik Sha, more on that. What is the common cause on why children are having these eye ailments?
Well, number one, I would just enumerate first, the top 3 children's eye diseases. Number 1 is actually error of refraction, which means you need to wear glasses. Number 2 is a condition called amblyopia or lazy eye, and the third one is strabismus. Strabismus basically is eye deviation. So with error refraction, all over the world actually, we're seeing more children nowadays and younger children who would need glasses. So there are actually several factors involved there: genetics, environmental factors, lifestyle, and several factors that has been implicated why we have more children who would need eyeglasses nowadays.
Okay, so back to Dr. Harvey here. Right now, we have what is the latest? Is there a latest statistics on the prevalence of cataract here in the Philippines, and what is Peregrine doing to help address that?
Cataract is the #1 cause of reversible blindness in the Philippines.
Yes.
There's probably 500,000 Filipinos who cannot see. And in Peregrine Eye, we can handle all sorts of cataracts. The latest technology is to do a robotic cataract surgery. So in this technology, we have a robot basically which uses a laser to soften up the cataracts, to help the surgeons do more accurate surgery, so that afterwards the patients will have the best vision and sometimes not need to wear glasses.
I think we're seeing some of the pictures here of that operation, I think, or is that a?
Yes, that's a cataract. It's basically proteins accumulating in the eye, and those proteins they block the light so that you cannot see, much like you have a dirty window inside your eye. And the goal of the surgery is to remove these proteins as safely and as quickly as possible, and then to replace it with a lens that will allow the patient to see clearly again.
Okay, doctors, is there a way to actually avoid having this ailment in the first place?
Well, for cataract, there's none, because cataract basically is an aging change. So everybody would actually really get it at some point.
Okay, so if we do get it, how long should we wait before we get that operation?
Well, the key is, are you functional? Can you do the things you need to do with your eyes? So if you reach the point where you're no longer able to read, or no longer able to drive, or walk properly, then that's the time you should have the cataract removed. And you should see your doctor regularly to get an eye exam.
Okay, so aside from cataract, what are the other causes of somehow blindness, whether it be temporary or permanent?
Well, another would be glaucoma.
Okay.
Yeah, glaucoma is an eye disease wherein the pressure goes up and then it damages the nerve. So it's a permanent damage. So if left untreated, definitely a person can go blind from that.
Is there a way that could we actually, well, which persons or which gender or which usually get these eye ailments like glaucoma?
Glaucoma usually, family history is
Okay.
a very strong risk factor for
Through
glaucoma.
genes.
Yes. And then usually it's the older people, that would get it. Although we also have like with what we call congenital glaucoma, but that's a different
Okay.
story. So the more the ones that we have mostly would be the ones where you get when you're older. So the problem with glaucoma is the person may not be aware that they already have it. So because most of the time there's no symptoms. So that's why an eye checkup by an ophthalmologist is very, very important.
Okay, and how long, how soon, or rather, how long do we need to get treatment once we do discover that, for example, we have glaucoma?
Oh, you should get treated right away. The good thing nowadays is that there's a lot of eye medicines that can be used to treat glaucoma. So we have a lot of choices and they work very, very well. So a lot of them, they just need drops actually for it. But the most important really is early detection and early treatment, so that you can control the disease process and prevent blindness.
Okay, so I'm also reading here, one of the somehow scarier parts of blindness is somehow the damage to diabetic retinopathy. So this is blindness caused by the increased somehow sugar levels in our blood. So can you please tell us more about that?
Yeah, Bruce, this diabetic retinopathy is becoming an epidemic, not just in the Philippines, but throughout the world. So when you have very high levels of blood sugar, the high levels of blood sugar damage these small blood vessels and nerves in the film of the eye. So some of these blood vessels, they would leak, and then you would have accumulation of water, fats, proteins in your retina, causing swelling of the retina and blurred, distorted vision. And some of the blood vessels would burst and there would be bleeding inside the eye. So fortunately nowadays, this can be diagnosed easily by the eye doctors using some tests. And we can now not only treat and prevent blindness, but we can also restore a lot of the vision of these patients by means of laser treatment to make the leaky blood vessels stop leaking. And there are also medicines to remove the swelling. We inject these medicines inside the eye, the swelling decreases, and the patients, for the most part, can regain their vision.
Okay, so you said there that somehow the cases of this is actually rising, not just here, but also the whole world. What's causing it?
I think it's the modern diet. We eat a lot of fast food, we eat a lot of processed food, so sugar goes up.
So I guess, well, I'll ask it anyway. So what are the ways on how we can actually avoid this, aside from, well, looking at our diet? What else can we do? Dr. Pik Sha?
Well, basically, if you already have diabetes, then you should have a regular eye check. Because you never know whether you're going to get the diabetic retinopathy or not. Of course, aside from diet, first is avoid getting diabetes, of course, because that's where it comes from. But if you already have diabetes, then the most important thing is to have your eyes checked regularly, because the retinopathy can be stopped, and you can still maintain good vision as long as the same thing, treated early.
Okay, so just finally, very quickly now, I just want to get back to pediatric ophthalmology. Right now, we have here the prevalence of divisive technology. How is that somehow contributing to the rise of somehow kids already having glasses? Is there a connection?
Actually, connection of near work,
Okay.
whether it's devices or reading. There are several studies that have been done, but some study says that there's a connection with near work to developing nearsightedness, but actually some studies said there's none. So at this point,
It's a bit debatable.
It's a
Yes.
bit debatable. It's controversial whether there's a correlation or not. But one thing that has been shown by several studies consistently is that children should have outdoor play, and that's the one that will help their eyes develop normally. Yeah, so I think that's one thing that nowadays children really lack.
Yes,
Because
that's
most
right.
kids are just indoors,
Right.
and they're not out playing. Yeah. So still for devices, what is important is to moderate it. Okay, I always tell the parents we cannot stop the kids from using devices. In schools they also have to use now. Schools are started to use iPad for education, so we definitely cannot stop. I mean, it's the modern world.
Yes.
But what we can do is to moderate the use. Yeah, because there may be a correlation to near work using devices with developing nearsightedness.
Okay, and I like what you said there, just get out and play. Again, we have here in the studio Dr. Harvey Uy and Dr. Pik Sha Uy. Thank you for sharing your insights with us this afternoon.
Thank you
Thank
for
you so
having us
much.
here.